So we do think it's an important event, and that many of the local regional recurrences, not the vast majority, are associated with a much higher risk of developing distant disease or metastasis and death. Some of the other things that we can say about local regional recurrences is the time of recurrence. So women who have early recurrences seem to do worse than those that present with later recurrences. Now, local regional recurrence isn't a single entity. It can involve the breast tissue or the soft tissue, the skin, or nodal tissue. And the type of surgery that took place for the treatment of the primary breast cancer also determines where the recurrence can occur. So for instance, women who've had previous breast conserving surgery, they are at risk to recur within breast tissue or in non-breast tissue, whereas women who've had a mastectomy obviously can only recur both in nodal tissue and in soft tissue of the chest wall. So in terms of women who recur in their breast tissue after breast conserving surgery, the vast majority of them experience a recurrence in close proximity to where the original primary cancer was found. I think we can divide these into two types: those that address the local problem, that is surgery or radiation, and the other one is systemic therapy. So in terms of local regional therapy, we typically classify patients into operable or non-operable local regional recurrences. For the operable recurrences, the recommendation has been by far that if one can remove the recurrence, that is the preferred modality. So in terms of women who have a chest wall recurrence after mastectomy, it's usually excision of the visible tumor with or without achieving necessarily negative microscopic margins. And for women who have an in-breast recurrence, either a mastectomy or in some select cases, repeat lumpectomy is possible. In terms of nodal recurrences, it's usually the excision of the nodal recurrence, or if a patient has not had a previous axillary lymph node dissection, a completion axillary lymph node dissection. In terms of systemic therapy, we have some more definitive data. The CALOR trial is a prospective randomized trial that studied the benefit of chemotherapy for patients who had local regional recurrences.